Spondylolisthesis is the slipping forward of one vertebral segment in relation to the vertebral segment below. The slipped vertebra can often be felt as an obvious step or jutting out of one vertebral segment when running one's fingers along the length of the spine. There are commonly two reasons for spondylolisthesis occurring. Firstly, there may be a fracture present in part of the vertebra, causing the segment to separate. This fracture may be inherited or commonly caused in young people by impact sports involving lots of backward arching movements of the spine, such as judo, ballet, gymnastics, cricket, and windsurfing. Alternatively, spondylolisthesis may occur due to wear and tear changes in the spine. This leads to a change in orientation of the small facet joints of the spine, allowing the vertebral segment to slip forward. Once the vertebra has shifted forward, it is not normally possible for it to go back and stay in its normal position, unless it is fixed in place with spinal surgery. However, spinal surgery is usually only reserved for severe cases where there is pressure on adjacent spinal nerves or where there is a very large shift in position. Less severe cases can be managed by modifying activities and using certain exercises to prevent further slipping forward of the vertebra. It is important to avoid overarching the spine backwards. Activities where there is a tendency for this to happen, such as breaststroke in swimming, are best avoided. Of particular importance are exercises that involve strengthening the abdominal muscles, strengthening and stretching of the spinal muscles, and stretching the hip flexor muscles. A physical therapist will be the best person to advise you on the correct exercise regime, and they may also be able to administer physical therapy that will help take the strain off the vertebral segment concerned.